Hello everyone, good morning. Today is 24th of December and welcome to the Hindu newspaper analysis discussion. So guys, let's start with the video. In this video, we are going to discuss the entire analysis of the Hindu newspaper. We'll take the relevant articles, we'll simplify them and we'll understand the articles with respect to the examination. Now, I would like to tell you that if you are watching this video for the first time, you can download the explainer PDF where we have taken up the articles and the simplified notes of all the articles have been taken up. This PDF is available at the Telegram channel and the link for the Telegram channel has been given in description box in YouTube, or you can directly go to Telegram and can search there by typing Thinking Palette by Sahil. Now, before starting up guys, first of all, let's take the overview of entire newspaper so that we can understand that what are the important articles that have been published in today's newspaper. So here we have the first page of the Delhi edition of the Hindu. First article talks about 81 crore people to get free food grains for 1 year. We'll see this particular article. Then guys, Bharat Biotech's nasal COVID vaccine is available as a booster. So see, understand this thing that you don't need to go too much into the detail because much relevant details are not there. But just one thing, that the Bharat Biotech has developed this nasal vaccine which can directly be taken through the nasal spray. Now this particular vaccine has been called as it is effective. It doesn't matter what you, now it is a precaution dose, that is a third dose it can be taken up. Earlier you have taken co-vaccine, Covishield, doesn't matter, this particular vaccine can be taken up. Okay, so it has been developed by Bharat Biotech. Now moving on in this particular direction, after that guys, regulator proposes full refund fees, free travel for seat downgrade on the flights. So if you have taken X classes seat and it is a downgrade, suppose if you have taken the business class and it is a downgrade, then entire fees is to be refunded back. Then moving on in the city section, the political news etc. has been given, advertisements not important for the examination. So directly we'll be reaching to editorial page. Elevating the scourge of private healthcare, we'll see this particular article. Fighting the cancer, we'll see this particular article. Then how Shakespeare entered Rajaji's mind and state. Now this particular article guys is talking about that how basically how C Raja Gopalachari got influenced by the Shakespeare. Okay, basically different books, fine, all these kind of things have been provided. Now the article is not important for the examination, no need to read. However, if you have interest as a leisurely read, you can but for exam, article doesn't contains much of substance. Then leave quietly. So guys, the article again basically not important with respect to the examination. Then we have the ground zero report, and in the ground zero report we see the basically the issues from the people's personal accounts etc. we are going to see. Now the ground zero report also basically what it is talking about, it's talking about that basically land deeds that were handed to the Bodo families, fine. Then further moving on, so today is Saturday and on Saturday we don't have the text and the context page, so therefore the text and context is not there. Then moving on, session ends in Rajya Sabha amid din over VP's remarks on the Sonia, fine, not important to follow because guys these political remarks etc. they are made quite a common in the house, fine, not important. Then moving on, in this particular direction, here we can see some important articles. Cabinet approves pending OROP provision. So we'll see that what is this one rank one pension and what has happened now. Then Russia India can help in reviving intra-Afghan dialogue. We'll see this article. After that guys, here you can see CAG, Controller Editor General, had pulled up the DRDO for delaying in completion of projects and failure to achieve key parameters. So there is the cost delays that have happened, and then that particular thing has been flagged in the CAG's report. Now no need to go and track this particular article for our examination. Then Uttar Pradesh and Tamil Nadu struggle with encroachment in centrally protected monument sites. Okay, so basically guys, it is talking about that how many centrally protected monument sites are there in different states and how many of them have been encroached. Okay, so this particular details have been given here. Then moving on, plea challenges panel to examine Supreme Court status on Dalit converts. We'll see this particular article as what it is all about. Then CBI arrest Chanda Kochar. All is well for MOA makers in this winters. Not important articles. Okay, no need to go in the details for the examination. Much substance is not given in the article. Then coming to the world page, Capitol Riot panel report says Trump lit that fire. So we have seen that on Capitol Hill in US there was violence that had happened. Fine, many of the protesters entered the public buildings there. Okay, so that was instigated by the Donald Trump. But no need to go and read this particular article for the examination. Authorities in China take overproduction of medical supplies amid COVID surge. So rising number of cases are going on. Then Sensex falls 1.6% due to the fear of COVID-19. Okay. Then after that, we can see Russia buys oil, says it may cut output. Now, engineering goods export to China 40% in November, EEPC. Okay. Now, guys, understand, then we have the corporate trends, etc. that has been given. Now, guys, understand this particular thing, that in every, understand this particular thing, guys, that every day in newspaper, there are many articles that come which might appear that they are very important for the examinations, but actually they are not that much important. You need to understand, actually aspirants end up wasting a lot of time on reading every article, but the article at the end of the day is not that much important. So we need to understand this particular thing. Okay, so therefore we take the overview. Now let's take the articles one by one in the detail. Okay. Okay, and meanwhile, very good morning to all of you. And in every class, we start our analysis with the GS quotation. Today, we'll take the quotation from Benjamin Franklin. So, Benjamin Franklin says that an investment in knowledge always pays the best interest. An investment in knowledge always pays the best interest. Okay, so basically, by this particular quotation, we can understand the value of education. So education is important in building the critical skill sets. It is important in building the vocations, in building the skill sets that are needed in the people. So therefore, any investment in education is one which gives the best interest, and therefore the governments particularly need to be very specifically oriented on the education and educational outcomes as well. Okay. Now, taking up the first article, and before that, I'll wish good morning to all of you: Meenu, Rajeshwari, Shakti Priya, Harsh, Akshay, Shri Agrotech, Pragati, Akashdeep, Sarita, Shripadi, Sarita, Ranjit, Lakshmi, Vipin, Afreen, Ganesh, Kumar Harsh, okay, Saiteja Adari, Shivam, Shraddha, Pallavi, Manjunath, Anand, Anil, Yasu, Sandeep, Anil, Mamtamay Satapati. Okay, synoptic notes are not available in Telegram. Okay, so it will be uploaded just when we end the class, it will be uploaded there. No worries. Okay, now, so first article, guys, 81 crore people to get free food grains for 1 year. So let's understand this particular article. By the way, this particular article we are going to see with respect to GS paper number 2. GS paper number 2, issues related to hunger. Issues related to hunger. Okay. Now, basically, guys, what's the case? When we talk about hunger, according to Global Hunger Index, India is ranked at 107, which is very poor. Okay. Moreover, at the same time, India has also promised that the people will be given right to food. And for right to food, we have National Food Security Act. Under National Food Security Act, 75% people in the rural areas, 50% people in the urban areas, and in total 66% people at the pan-India level will be provided the subsidized food grains. Okay. Now, as per the National Food Security Act mandate, it has been provided that basically subsidized food grains are to be given, and the households will be divided in two parts. There are Antyodaya Yojana households, which are given 35 kg food grain per family. Flat food of 35 kg is given to them. Then there are the priority household, and the priority households are given 5 kg food grains per person. Okay, so if there are 4 persons living in one household, they'll be getting maximum 20 kg. Okay, so Antyodaya Yojana and priority household. Antyodaya Yojana households are the ones who are poorest of the poor. Okay, this is right now going on. Now, as I told you that the food grains will be provided at subsidized prices. It will not be free. It will be highly subsidized. For example, 3 rupees kg rice, 2 rupees kg wheat, and 1 rupees kg coarse grains. 1 rupees kg coarse grains will be provided. So this is the present mechanism that's there right now with respect to the food allocations under the National Food Security Act. Now, guys, actually there were some developments that happened in this particular direction. For example, in 2020, when COVID-19 pandemic started, what happened? Government came out with the Atmanirbhar Bharat Abhiyan, and under Atmanirbhar Bharat Abhiyan, the fiscal stimulus was given and many of the welfare reliefs were given to the poor people. And as a part of the Atmanirbhar Bharat Abhiyan, there was one scheme that was started under Atmanirbhar Bharat Abhiyan, that is Pradhan Mantri Garib Kalyan Ann Yojana. And under this Pradhan Mantri Garib Kalyan Ann Yojana, it was provided that over and above whatever food allocations are being given under National Food Security Act, apart from that, 5 kg additional food grains will also be given. 5 kg additional food grains will be given under the Pradhan Mantri Garib Kalyan Ann Yojana. Now, this scheme got started in 2020, and since 2020, it has been extended multiple number of times, and from 2020, it extended till September 2022. It was going on. Now, government had come, the cabinet had approved certain changes in this National Food Security Act's mandate. And what changes now they have made? So basically, government had decided that all the beneficiaries under the National Food Security Act, by the way, around 81 crore people, 81 crore people are getting the benefit under the National Food Security Act. They will get the free food grains for 1 year. Now, you understand this particular thing. Earlier, I told you they were being given the food grains at 3 rupees, 2 rupees, 1 rupees per kg. But now, will not charge this particular amount even. The food grains will be provided free of cost. Government had merged even the Pradhan Mantri Garib Kalyan Ann Yojana under the National Food Security Act. So the additional 5 kg food grains that were being provided, that will not be going on. It got subsumed under National Food Security Act. But earlier, when the people were paying 3 rupees, 2 rupees, 1 rupees, they don't need to pay. Entire food grains will be provided free of cost for the next 1 year. And it has been provided that the entire burden of this particular cost will be borne by the center government. The center government will be taking the entire burden. Now, anyhow, as we talk about the design of this particular scheme, guys, under the National Food Security Act, the basic design is this. The basic design is something like this, that basically center government will provide the food grain, will be providing the food grain to state governments, and this particular food grain will be provided through the Food Corporation of India. State government's responsibility is that they need to identify beneficiaries. And the states actually, through their public distribution systems and fair price shops, will be providing the food to these beneficiaries. So anyhow, the financial implication is on the central government only. Is it clear or not? Fine. So this is, guys, the change that had come. I hope that you have understood it. Fine. Now we'll be moving to the next article. Cabinet approves pending OROP revisions for the veterans. OROP stands for one rank, one pension. Now, before going in this particular revision that has happened, let's understand first of all that what's this OROP, why this OROP is important, and what has happened now. Okay, so basically this article will see with respect to GS paper number 2, government welfare schemes. Okay, now let's discuss with this particular article. So basically, guys, what has happened? Basically, when we talk about the armed forces personnel, yes, when we talk about the armed forces personnel, okay, their retirement age is less compared to the people who are working in civilian professions. Okay, for example, guys, when we talk about the armed forces personnel's retirement, so the different ranks, the retirement age is different. For example, the Jawans in the armed forces, the Jawan, they will be retired at the age of around 35 years. Okay, then the basically the NCOs and JCOs, okay, JCOs and NCOs, they will be retiring at the age of the 40-45. Officers, they retire at the in early 50s. Okay, and guys, the time when they retire, on the basis of the salary that they were getting at the time when they were in the service, on the basis of this particular salary, their pension will be calculated. Now, guys, understand this particular thing. that when a person spends a lot more time, when a person spends a lot more time in the service, what happens, time to time there are the pay commissions that come, and the pay commission revise the salary. Okay, so pay commission revise the salary. Now if a person is spending less time in the service, obviously that particular person will not be able to face multiple pay commissions. Okay, and on that particular basis a particular person's pension will also be calculated. Now let's say a Jawan is retiring at the age of 35, and at the level, and when he was 35-year old, the salary that he was getting, on that particular basis his pension will be provided. Now when this particular person will turn 65 years old, okay, 30 years have happened, and even now he is getting the same pension that was decided on to the basis of 30 that was decided when he got retired. Now what has happened, over the years there is a lot of disparity, a lot of difference that has come in the pensions that the officers are getting who retired at the same rank. So basically, guys, understand this particular thing. Suppose a jawan retired in 2000, and a jawan another jawan another jawan retiring in 2022. So in between we see that the 22 years gap is there. Now suppose we call these two Jawans as Jawan A and Jawan B. Suppose both of them have served the same years in the Indian Army, let's say, and now they are retiring. So basically this particular Jawan's pension is calculated onto the basis of the salary that he got at that point of a time. The B Jawan's pension will be calculated onto the salary that he is getting today. Now obviously the Jawan B's salary today will be much higher than Jawan A's salary. Why? Because there is the pay commission revisions that had happened. Okay, inflation have been accounted, obviously his salary will be high, and therefore the pension that he will derive will be high. So therefore what has happened, the difference has come. Both of the Jawan A and B retired at the same rank, they served for the similar kind of a time duration, but their pension amount is different. So therefore under one rank one pension, there is a demand that if the personals into the armed services, they have retired at one rank, there should be the same pension for all of them, irrespective of the fact that when they are getting retired. So it has been provided that even if a person retired in, let's say, 2010, fine, he should also be given the revisions into the pensions. Okay, he should also be given revision into the pension onto the basis of the pay commission recommendations that are coming. So this was the demand of one rank one pension plan. Okay, so I have written here formally also so that you can read it. So OROP, one rank one pension, means the payment of same pension to military officers for the same rank for the same length of service, irrespective of the date of retirement. Is it clear or not? Fine. I told you that before one rank one pension, ex-servicemen used to get pension as per the pay commission's recommendation when they had retired. So at that point of a time, let's say there was the fourth pay commission, what salary that had recommended, on that basis pension will be given. Today, let's say let's say another soldier got retired when the sixth pay commission was there, he will get the salary on the basis of sixth pay commission recommendation. Obviously sixth pay commission recommendation salary will be higher than the fourth pay, so the soldier who is getting retired later will get more benefit. Fine. Now it has also been provided that now this particular demand was there. Now earlier what happened, government provided that yes, one rank one pension will be implemented, and earlier government implemented it for the armed forces personnel who have retired till 30th June 2014. They were covered in it. But then there are other people who got retired after 2014. Then there was another demand that came that no, you need to include other people who retired laterwards also. And now what government has done, government has extended this, and government had said that the scheme will be implemented for the persons who retired till 2019. So it is not the case that earlier it was not implemented. It was implemented, but now it's being extended from 2014 till 2019. So people who are retiring here, they will be getting the benefited, they will come under the revision. Now this scheme was implemented on the basis of the Koshiyari committee, which was formed under the chairmanship of the Bhagat Singh Koshiyari. So this is that has happened in this particular direction. So guys, I hope that you have understood it. Okay, now we can do a little bit critical analysis of this particular development also, whether it is good or not. So basically, there are the viewpoints that can be given from the different sides. Number one, it is being said that it is good. Why? Because as the armed forces personnel, they are retiring at less age. Okay, they cannot get the benefit of the multiple revisions that will be given by the pay commission. When the people working in other civilian professions under the government of India, their retirement age is somewhere around 60 years, and in that capacity they will be serving for a long period, and multiple pay commission revisions they'll be able to face. Their salaries will increase, and then their pension will also be high. So therefore it is bringing discriminations on the armed forces personnel, so therefore it should be implemented. Fine, one thing. But on the another hand, it has been said that no, it is not good also. Why? Because it will put the fiscal burden. It will put the fiscal burden on the government of India, and then by this particular thing, the paramilitary forces or the other service personals will also be demanding the same kind of a thing. So this has been something that has come here. So guys, if you read this particular article, in this particular article there is just one line concept that has been given, that now government will revise the one rank one pensions implementation at 2019 level. So now government will revise, that has been provided. Is it clear? But no, beyond that also there is a lot of background that you need to see that we have discussed here. That's all about it. Now let's move to the next article. Russia India can help in reviving intra-Afghan dialogue, Zamir Kubolov. Okay, now basically this particular article, guys, we are going to see with respect to the India and neighborhood relations, GS paper number 2, and within the GS paper number 2 IR, international relations. Okay, now guys, basically what is this article? This article is actually an interview. This article is actually an interview with Russian special representative for Afghanistan, and his name is Zamir Kubolov. Okay, you don't need to go too much into the detail. So this is a kind of an interview that has happened. Okay, now here he is providing this particular thing, that right now in Afghanistan there is a crisis that is going on. If you are following newspaper analysis regularly, just couple of days back we have seen this particular thing, that the Taliban had ordered that women will not be allowed to get the university education, and in past also many such kind of orders on women have been passed by Taliban. So Taliban is right now facing a kind of a crisis, and there is a need to carry the intra-Afghan talks, intra-Afghan dialogue. Now what do we understand by intra-Afghan? Intra-Afghan means that the different parties in Taliban, for example, in Afghanistan, for example, Taliban is there, then the government of Afghanistan before the Taliban came. So government of Afghanistan before the Taliban came, that is there. Then after that there are other minority groups. Okay, so these are the parties who are there in Afghanistan, who have stakes within Afghanistan. So they should come together and they should talk that how governance of Afghanistan can be carried, how reforms in Afghanistan can be brought. So there is need for intra-Afghan talks. Now understand this particular thing. India in past, when Afghan peace negotiations were being signed in 2020 under the Donald Trump, at that point of a time India very clearly said that Afghanistan peace talks should be number one Afghan owned, Afghan controlled and Afghan led. And India very clearly provided that the stakeholders within Afghanistan should be given the most important priority. But that particular thing did not happen much. Why? Because USA in 2020 was very much tired, because from last 20 years they were there in Afghanistan. We know this particular thing, that USA landed in Afghanistan in 2001 and stayed there till 2021. So 20 years USA was very much tired. USA did not focused too much on intra-Afghan dialogue and pulled back, and now we see that Taliban has taken over in Afghanistan. So basically the Russian special representative is simply saying that now they should focus on intra-Afghan dialogue, and Russia and India both will help. Okay, so this kind of an interview that has been given. However, guys, apart from this particular interview, I want to give you some additional suggestion points apart from this particular interview, that what we can actually suggest. Is it clear? So basically, we can give the suggestion of Moscow format talks. Moscow format talks. Now, when we talk about the Moscow format talks could be strengthened for intra-Afghan talks. Now, what is this Moscow format? Moscow format, guys, is a kind of a dialogue that is being carried, fine, and in this particular dialogue, there are the countries such as um, Russia, China, Pakistan, Iran, Tajikistan, Kyrgyzstan, Uzbekistan, Turkmenistan, and India. Now, all these particular countries are basically carrying a dialogue that how the peace can be brought in Afghanistan after the USA's withdrawal. How the dialogue basically how the Taliban can be brought on the table for the negotiations. Now, India had already joined the Moscow format consultations, and it was held recently in Russia also. Now, in these particular Afghan talks, Moscow format talks that has recently happened, basically it was discussed that how the humanitarian situation is evolving in Afghanistan, okay, and how the assistance can be provided in Afghanistan, intra-Afghan talks, how they can be carried, how the inclusive and representative government can be formed in Afghanistan. Moreover, in these particular talks, it's also being discussed that how the basically these are the focus areas that were taken: consultation for the respect of all Afghan ethnic groups, respect for minorities rights, national reconciliation is to be brought so that all the stakeholders come together. The next thing that was taken up in these Moscow format talks, the latest talks 2022 that have happened, was basically a joint statement was issued, fine, after this particular meeting, and it stressed upon ending all terrorist infrastructure in Afghanistan. Okay, then it also talked about ensuring basic rights and freedoms of the all the people, including the women. Then it talked about the fundamental rights of all the ethnic groups, minorities, women, children needs to be strengthened, equal justice is to be provided to the people. And then it also talked about complete unfreezing of the Afghanistan's assets, the Afghanistan's money that has been held into the bank accounts, fine, in America or elsewhere. All those assets need to be completely unfrozen. So these were the talks that were taken up in the Moscow format talks that recently held in Russia, and India also participated. So by the such a Moscow format, the intra-Afghan dialogue can be brought out. Okay, so this is something that needs to be taken up. Is it clear? So guys, basically in interview, much important substance is not given because a lot of disconnected points are there. So therefore, please note down this Moscow format. So that is all about it. And now we'll move to the next article. Fighting cancer. Fighting cancer. Now, this particular article, guys, here we have taken this similar article in yesterday's newspaper analysis also, because now the government has rolled out the vaccination for the cervical cancer. Cervical cancer. Now, guys, when we talk about the cervical cancer, understand that cervical cancer is one of the deadliest cancer which is taking large that is claiming the lives of so many of the women. Okay, when we talk about the cervical cancer, what we understand by cervical cancer, so basically cervix, okay, cervix is the lowest part of the women's uterus, and in the cervix there is sometimes we find this particular thing that the cancer, the basically the cancer, the cancerous, just a minute. Yes, so we find this particular thing that the cancerous growth starts around the cervix, and because of that particular thing, many of the women they die. Now, in this particular direction, guys, recently there was a Lancet report that was carried, and as per the Lancet health report, it was provided that India accounts for the highest number of the cervical cancer cases in Asia. Largest number of cases come in India, in the Asia. 58% of all the cases of cervical cancers globally, they were estimated in Asia, and out of that 21% cases and 23% of deaths are from India, which is very much high. Now, in order to tame this particular thing, what has happened? Government had announced that the vaccines for the cervical cancer will be provided to the women, and the women in the age group of 9 to 14, they will be provided the vaccines, and these vaccines will be provided through the schools. Now, when we talk about, guys, the cervical cancer, it is preventable and it is treatable cancer. So therefore, all the deaths that are happening, they are avoidable, they can be avoided. When we talk about cervical cancer, it is caused by human human papilloma virus, okay, and the vaccines can protect. In this particular direction, guys, it has been provided that India has also developed the vaccine. Okay, India has also developed the vaccine, and this is the indigenously developed Ceravac vaccine, and by mid 2023 this particular vaccine will be rolled out. So this is also a kind of an achievement of India, that we have developed in-house indigenous vaccine. Now, when we talk about the cervical cancer, in this particular direction, International Agency for Research on Cancer and WHO, they have specifically provided that the incidence, the number of women infected by this particular cancer, it needs to be reduced down. It has been provided that incidence rate of less than 4 needs to be there per 1 lakh women. This is something that's desirable. And for this particular thing, it's very much necessary that 90% of the girls, okay, by the age of 15 needs to be vaccinated by the cervical cancer vaccine, HPV virus vaccine. Now, what government has done in order to make it successful? Government has basically decided that it will be infused with the UIP, that is Universal Immunization Program. Now, Universal Immunization Program is world's largest immunization program that the government of India is taking, and under the Universal Immunization Program, the vaccines, the 2 crore newborns, 2 crore pregnant women are being targeted annually, and they are being given the vaccines against 12 diseases. So under Universal Immunization Program, now the vaccine of cervical cancer HPV virus will also be provided. Is it clear or not? So this has happened. Now, guys, when we talk about this particular vaccine, that is the Ceravac vaccine, it has already been given approval. It has already been given approval by the Drugs Controller General of India. Fine, and it has also been cleared by National Technical Advisory Group for Immunization. Okay, now the government will be addressing the schools. The government will be addressing the girls through the schools. It is a very innovative and a very good suggestion. Why? Because when we talk about the women and girls enrollment into the schools, it's high. But yes, the girls who are out of school, they will also be targeted by the community reach program. So this is something that has happened. So guys, I hope that you understood this particular article. Fine. So very good article and a very important development, in fact, for women's health. So therefore, for GS paper number 2 health, this particular article would be taken up. So that is all, guys, about it. And now let's move to the next article. Alleviating the scourge of private healthcare. This article will see with respect to GS paper number 2 health. GS paper number 2 healthcare. Okay. Now let's start with the article. So basically, guys, when we talk about the health, right to health has been declared as implicit right under the Article 21, right to life. Now, but when we talk about the healthcare, the condition and the quality of healthcare in India is not very much good, and for that particular thing, we have certain data, certain facts to prove it. For example, it has been provided that India ranks poorly on multiple health financing indicators. Government is not giving adequate money for addressing health. It has been provided that public health expenditure as a percentage of GDP is just 1.2%. So 1.2% of the GDP is being spent on the health. And when we talk about the expenditure on the health as a part of the general government's expenditure, so total government expenditure, what it is doing, out of the total expenditure, how much percentage is going on health? It is just 4.8%. So nearly 5% of government's total expenditure is on health. Now understand this particular thing, that we are going to become the most populous country by 2023 March April. We will become most populous country, and in that particular capacity, just 5% of government's expenditure is on the health. It is not adequate. We all the time talk about demographic dividend, that is the favorable advantage that we will get because of the young population that we are having. But understand, demographic dividend automatically will not give economic benefit. We need to ensure that our population is healthy, it's having certain skill sets, it's having certain vocations. Now when we talk about health, it's very important, and how the health will be addressed if adequate funding will not be given. Now, it has been provided that when we talk about the healthcare in India, dominant role in the healthcare will be provided is played by the private health sector. Fine, private health sector is catering to large number of people's in need. But at the same time, we know this particular thing. That healthcare cost always remain very high. Why? Because private sector health setups are oriented with profit. Government healthcare setups are not adequately funded. They don't have adequate number of beds, nurses, doctors, and even the quality of service which is being given in the public healthcare, it is not very good. So people go to private, and private caters to maximum number of people, but the costs are very much high. Okay, so therefore automatically a kind of a issue comes that government spending needs to be increased on the healthcare so that the personal spending can be reduced. Okay, so government spending is to be increased so that the personal spending can be reduced. Government needs to provide public healthcare facilities in such a way that we don't need to go into the private sector. Now, when we talk about the private sector healthcare facilities, they are dispersed. Number one, there is a lot of inequities between the rural and urban areas. Now, how the inequities are there? Understand this particular thing. Large number of health facilities are situated in urban India, but people are living in rural areas. As per Niti Aayog, 41% of people will live in urban India by 2030. As of now, majority of people are in rural areas, but healthcare facilities are in urban areas. So this is a kind of a disparity, inequality. Then on the basis of income inequality, backwardness, under regulation, private sector gets the incentive to create a different kind of product to cater to different kind of people. You have multi-specialty hospitals where healthcare is very expensive, and those hospitals cater to rich affluent class of people. Then we have other hospitals which might not be that which will be catering to the middle class, and then there will be the certain private healthcare facilities which will might be catering to the people from lower middle classes. But as we come to these healthcare facilities, as we come down, we find that the attention, the quality of healthcare also goes down. This is something that should not happen. Now guys, when we talk about the health is attached with one's right in the capacity of a human being. So whatever happens, decent quality of healthcare has to be given to everybody, irrespective of the fact that whether they can pay or not. But no, that doesn't happen. You can get good health on the basis of your paying capacity. So therefore we find this particular thing that often what happens, the private healthcare sectors, they provide inexpensive the healthcare at inexpensive rate, but that healthcare is of dubious quality, not very good. What we need to bring, we need to ensure that decent healthcare is being provided to all the people at decent prices. Now, there is a need for overarching policies which will drive down private healthcare cost, okay, which will bring down the private healthcare cost with little or no government subsidy. Now, guys, you know this particular thing. I want to just give you one example, little beyond the scope of this particular article. We have Ayushman Bharat Abhiyan. Under the Ayushman Bharat Abhiyan, 5 lakh rupees health insurance is provided for many diseases. So a person can go to a private hospital. Now, the treatments are provided in private hospital also under the Ayushman Bharat Abhiyan. So a person can go to a empaneled private hospital, can show the Ayushman Bharat Abhiyan card, can take the treatment, and is not required to pay back the money. What happened? Government will pay the money from the back. So this healthcare is subsidized. Okay, now the policy that's are needed to be brought is such that even without the subsidy, even if a common person who is not enrolled under any government scheme is going to a private healthcare, that particular person should get the healthcare at a decent price. Such kind of a thing is needed to be provided. So public health insurance schemes have often been rebuked for imposing unreasonable package rates. Now understand this particular thing. Basically, when the empaneled hospitals are there, people are taking the treatment into the back end, the government will settle that particular bill. Now often it has been provided that on unreasonable prices they are being settled. Okay, for example, X procedure cost 10,000 rupees, government will settle at 8,000 rupees. Now in this capacity, the quality will be degraded when the people having who are under empaneled schemes they are coming. That is something that happens. Moreover, often it has also been seen that just to get the reimbursement, the doctors are suggesting unnecessary procedures and operations and all such kind of things. Now, here it is being provided that a good start can be in incentivizing the business process innovation. So in the healthcare we need to innovate as what different how by different models good health can be provided. So different innovations are needed to be brought into the healthcare. Now such innovations have been brought in few philanthropic organizations. Okay, for example, Tata Memorial Hospital is there in Mumbai, who is providing the cancer for the cancer treatment. It is providing and it has done a lot of innovations. Okay, so we need to bring a business process innovations. A few good organizations have done, but others have not done that particular thing. We need to, the healthcare ecosystem does not naturally incentivizes the innovation. Fine, we need to push them. Now when we talk about Indian healthcare, it has seen a double whammy. Double whammy means a double burden. Number one, regulatory infirmity is there, and second, unfulfilled economic promises are there. Is it clear? Now, basically, many of the state governments have their own Clinical Establishment Act. Now, what is this Clinical Establishment Act? Clinical Establishment Act provides that certain decent quality of healthcare has to be provided to everyone. Unnecessary operations cannot be imposed on the people. There needs to be the ethical conduct by the doctors. So to regulate the conduct of doctors, to regulate the conduct of the hospitals, Clinical Establishment Act is there. The states have implemented it, but they are short of full implementation. Still there are many gaps that have been there. Now understand why the healthcare is important in India. We also need to understand the fundamental reasons. Fundamental reason is the expensive medical education. Now a person who is becoming a doctor is spending around 1 crore rupees. So a person needs to recover that 1 crore rupee after the person becomes a doctor. Under that particular thing, what happens? The healthcare becomes expensive. So expensive medical education also trigger the cost recovery through resource intensive ways of practice. We need to take steps on multiple dimensions, including this. Multiple steps to reduce entry barrier in medical education has been taken lately. Medical education cost have increased, but we need to bring them down. Moreover, at the same time, government also need to understand that we need to make private healthcare affordable, cost effective, but at the same time government cannot withdraw from this sector. Government at the same time also need to ensure this thing, that they through public hospitals are also providing good and decent healthcare. So this is some suggestion that's been given for the healthcare in India. That is all guys about this particular article. I hope you have understood it, and now we'll move to the next one. Plea challenges panel to examine Supreme Court status for Dalit converts. Now, what is this particular article? And I'm sure if you're following newspaper analysis regularly, you know this particular article. We have discussed it in the month of October, month of September and October. So basically, what's the issue? Guys, issue is this, that when we talk about the scheduled caste status, so scheduled caste status is given to the Hindu Dalits, because they have faced a lot of discrimination. They were denied the opportunities for education, they were denied the opportunities for equal participation in public life, and therefore they have been backward, they have been downtrodden. So therefore, to make up for that particular justice, Hindu Dalits are being given the reservation status. That is happening. Okay, now over the years we have seen this particular thing, that the people who were given the scheduled caste status, they got converted in other religion. For example, they got converted in Sikhism, they got converted in Buddhism, etc. Now what will happen to a person who was scheduled caste but converted the religion, changed to another religion, and now will the SC status be given to them or not? In this particular direction, guys, we have the Constitution Order of 1950. Now Constitution Order of 1950 recognized that the scheduled caste status will only be given to Hindu Dalits. But now then this Constitution Order of 1950 got amended. For example, in 1956 it was provided that the Hindus will be covered, and apart from the Hindus, Sikh converts will also be covered. Sikh converts, the people who were scheduled caste and they converted to Sikhism, they will also be covered. Then in 1990, there was one more amendment that was brought. It was provided Hindus will be covered, Sikh converts will be covered, and Buddhist converts will also be covered. Okay, so the people who converted to Sikhism and Buddhism, if they had the SC status earlier, then that SC status will be given after their conversion also. This is something that had happened. Now, in this particular direction, guys, there is a demand that's coming. There is a demand that's coming that what about the scheduled caste people who converted to Islam and Christianity? Islam and Christianity. Why they are not being given the SC status after their conversion? Why discrimination is happening with them? So this demand was there. Now, guys, recently the Supreme Court has also asked the central government that what is your viewpoint on this particular thing. Now, what has happened? Central government has said that we will constitute a commission to study this particular matter, and KG Balakrishnan Commission, KG Balakrishnan Commission has been constituted to study this particular matter, as whether the reservation should be given or not, what happens to the social condition of a person who has changed the religion after the conversion. For all this particular thing, KG Balakrishnan Commission is constituted. Now, the petition has been filed, fine, in the Supreme Court has been filed against this particular step. Now, what is the basic problem that has come? So basically, it has been provided. Yes. So basically, it has been provided that basically this new commission has been created with wrong intention of delaying the justice on the petition. Basically, guys, the issue that's coming here is that in the past, multiple commissions have been constituted. Okay, multiple commissions have been constituted, and it has been said that existing commissions and report, they have suggested that SC status should be given to Dalit, Christians and Muslims. Okay, all the earlier status, earlier commissions, fine, from the first backward commission, Kaka Kalilkar commission, multiple commissions have come which have suggested that yes, they can be given. Now the petitioners are saying that you have constituted another commission, it is just to delay. Why? Because a timeline of 2 years have been given to this particular commission. So it is just to delay the process. There is no some genuine exercise that is being taken. So it is created under a wrong intention. Okay. So this is, guys, about this article. I hope you have understood it. And now moving to the mains practice question. So mains practice question for today is, affordable private healthcare must only come to supplement strong public healthcare. Analyze in the Indian context. So this will be a 10 marker question for GS paper number 2, health. Okay, so guys, today we had less articles in the newspaper because editorial, much relevant articles were not there, and even text and context did not got published, where we get at least 2 articles at least, which are good. So that is all, guys, for the today's newspaper analysis. With this, we come to an end to the today's analysis. Now we'll be meeting on Monday. Till then, guys, please take care of yourselves. Thank you so much. And if you have liked the video, please do hit the like button, and your lovely comments. I am very, very thankful to all the lovely comments that you leave, and I am really grateful to all the support that you guys are giving to this